Hey everybody, it's Dr. Seiler from Seiler Skin. We're going to shoot a really cool video today of me doing some Redensity Filler. This really has become one of my favorite fillers now. We've only had it for about 4 or 5 months now in the US. The UK's had it for probably 7 or 8 years. It's in the same line with the other RHA fillers. So you know we have RHA 2, 3, and 4. This is technically RHA 1 in Europe and Canada, but it's called Redensity in the US. I'll be honest with you, I was a little skeptical in the very beginning when they told us this was coming out, because I'm not really one to chase lines, because the other fillers are usually too thick to do that. But this is a really, really thin filler. It's really good for little vertical lines around the mouth. We've been using it for about 5 months or so, and it's really unique. You see a little bit of a result in the beginning, but we were telling our patient here, who's nice enough to let us film this, and she's got great skin. We won't tell her age, but she does not look her age. And she takes really good care of herself. But it's interesting that after about 3 or 4 weeks, it just fills in the tissue. It's almost kind of like if you have a container of different sized marbles and you put some sand in it, it just kind of fills in the gaps or the holes. We do put a little numbing cream on for this just because it's a lot of little sticks, but patients have tolerated it fine. Usually you don't have much bruising from it. I was concerned in the beginning if we would really get good results without having to use a lot of it, because it is so thin, but we've gotten incredible results with only 1 or 2 syringes of it. And I can just kind of thread the little fine lines. Because we put the numbing cream on it, you know, it's a little tedious getting several little sticks like this, but people have tolerated it fine because it's very, very shallow. And this is the only filler that I really think that you can thread some of these tiny little fine lines around the mouth. I usually do Botox first in patients to get their muscles to kind of shut down a little bit so the little vertical upper and lower lip lines start to soften. But you can see that I'm just doing a bunch of little tiny micro injections here. And part of the reason for me to kind of show this is I really seriously did not think that we would use this as much, but we're using a ton of it now. And it's great for patients that either aren't getting other types of tightening procedures. We use it a lot after a series of Vampire facials or Vivace just to help patients see a good, pretty instant result while they're getting some collagen stimulation and skin tightening. Let's hit there in the middle. We've also got our little Acuvane here that you guys know we're really a big fan of using. This is the newest version of it, and it really helps to show all the little fine lines, fine vessels on the skin. So greatly reduces the bruising. We got a little liquid on you. And also really helps me to keep from hurting the bigger blood vessels when we get into some of the other areas. But you can see that, I mean, this is such a shallow injection that I would never do this with another filler. This is actually going into the dermis of the skin and the sub-Q. So it's really cool to be able to do this. And then the other thing that we can do with this that we really were never able to do with other fillers is treat these really fine little laugh or smile lines that are what we consider movement or dynamic lines, which I usually encourage most people in the cosmetic world not to try to chase with filler, because most of your other fillers are just going to be too thick. And if the patient moves a little bit, then you can see the filler if you put it too shallow. So this has just been great. It's been a great addition. Again, it's called Redensity. It's in the RHA line of fillers, which have really become popular in our practice. And if you're interested, check it out on our website. We'll have some good before and after pictures, and happy to talk to you about it in person. So thanks for watching.